All right, guys, I'm back. It's Dr. Ariana here at Tula Wellness, and I'm with Melissa. We are in the middle of her vaginal rejuvenation treatment, and we've already done the Mona Lisa Touch, which is the CO2 laser. We did the Thermiva, which is using radio frequency, and then we are icing the cake with what's called the O shot. So the O shot, otherwise known as the orgasm shot, is a procedure where we inject platelet-rich plasma into the tissue, the vaginal tissue, specifically into the clitoral area and into what is considered the G-spot or the periurethral tissue. So in Melissa's case, she had some vaginal dryness, pain with intercourse. Her first treatment with Thermiva was a success, and she came back to do some more. She had complete resolution of her urinary incontinence and felt more sensation, and basically it was a good thing. So she's back. It's been a little bit over a year because of COVID, of course, and she's back for more. And you had the O shot last time. Do you feel like you can discern the difference between any of the treatments and what you felt like the O shot might have done for you?
Honestly, I study a lot of wellness and how the body heals and reacts to things. I just think it's your holistic approach of the O shot in combination with the Thermavia, and now this is my first time to get the Mona Lisa, but as you describe it, those other treatments kind of irritate the tissue a little, and then I feel you add the plasma and you're just doing the whole renewal process. The plasma is going to just really stimulate the healing. I can't really distinguish which. I think it's just your holistic approach.
Yeah.
It's.
Now, I just did your O shot. Did you feel anything?
No.
Yeah. So a lot of people are afraid of it because they're like, what? You're sticking a needle where? But I got a really great way. If you're trying to do this procedure, you'll know that there's a specific way that we anesthetize and just get the numbing just right. So we first apply a numbing cream. Then after that numbing cream, I apply ice. So we put a little balloon, hold that ice there for a while. After that, then I numb with the actual injection of lidocaine. And then after that, we put the ice back on again. And then after that, we actually do the procedure. So by the time I go to do the actual injection, and I'm doing it right now, and she's kind of like, oh, just chilling. By the time we do that, everything has pretty much been numbed and is very comfortable. When did you start to see the results of your treatments?
Immediately.
Yeah?
Immediately the first time. Instantly, my sense of urgency to need to urinate was gone within 24 hours, or probably within 12 hours. And then, of course, we didn't have intercourse for 3 or 4 days, let things heal. And from the first time that we did, the sensation of it being so tender was completely gone, and it just got better and better with time. And then probably about 2 months after getting the last treatment, I began to notice that I was producing my own mucus again, my own clear lubrication.
You were lubricating? Mm-hmm.
Right. And I was noticing that almost like you do, like when you were younger and you would notice that you would cycle, and you would go to use the bathroom and wipe, and there would be the clear mucus.
Yes.
It wasn't just during sex that I was noticing that lubrication. So that was super exciting.
So yeah, one of the things that I talk about a lot is vaginal dryness. It's like the best kept secret for perimenopausal and menopausal women. So with that dryness, it really does affect the vaginal tissue, and intercourse becomes painful. And once it's painful, it's kind of not fun. And we're already, usually as if you're a mom and you're working, or even if you're not working, you're busy, you're tired, and our libidos are already not necessarily where they were when in our 20s and in our teenage years. But you combine a not so robust libido with pain with intercourse, and that's kind of like a wrap. So it's really done wonders for relationships. I've had patients that literally haven't been able to have intercourse for almost a decade, and they've had the treatment, and they really are back to a fully functional sexual lifestyle with their partner. So, and that's just an important thing about a relationship, right? We talked about that in the last video about how you're starting to feel like a disconnect with your husband because it was painful and he wanted to have more sex, but you're like, yeah, but I don't know. So this really does help to bring some intimacy back to the relationship. And it, I really can't say enough about it. Some days I get probably more excited about vaginal rejuvenation than I should, but it's really nothing more gratifying when a patient comes in like you and tells me how it really has changed their life. So it's kind of why I went into medicine. I had my own issues and somebody changed my life, and so the fact that I'm able to on a daily basis have people come and tell me that I changed their life is just makes me know that's what I'm here to do. So I'm so happy that you shared your story with me and that you let me tape during your O shot. And I know this part's a little more uncomfortable for you, right?
Yeah, but you've numbed it some more, so
You're okay?
I'm fine. I'm totally fine.
So we're done pretty much with the O shot. I did a little bit of the thermia inside. We're gonna do a little bit on the outside, but just wanted you guys to know, don't be afraid of exploring the idea of intimate wellness. At Tula Wellness, we really recognize and understand the fact that as we're aging as women, we need to have these conversations, and this is a topic that is, in my opinion, has been under discussed, under researched, and really we haven't done enough as physicians and as a medical community to treat the issues that women have. And by 35, definitely 45, you're going to start noticing some changes, and you don't have to suffer through some of this. And it doesn't mean you have to do a full-on treatment of vaginal rejuvenation. It could be vaginal estrogen, maybe just taking a look at your hormones and figuring out what's happening. But what is happening for sure is that we are perimenopausal, and during these years, our bodies are changing a lot, and women are really confused about what's happening and what they can do to correct it. So if you have questions, feel free to reach out. I'm Dr. Ariana. We're here at Tula Wellness in Tucson, Arizona. Our website is tulawellnessmd.com, and give me a call and let me know if you have any questions. We'll talk soon.